Hey guys, this is Dr. Hub. Whether you're in medicine, from specialty to super specialty, allied sciences, or simply curious, this focus content it delivers the key points you need to know. Let's continue with the localization of the human genes. So we are entering the part 2. So we saw about the first video, we saw insulin, then we saw prolactin, growth hormone, and the alpha globulin. Now we'll discuss about the beta globulin. So under this beta globulin, the chromosome which is involved will be the 11p12. So this is very similar to that of the first one we saw. So to recap, insulin, it had a very similar chromosome. It is 11p15. This is insulin. So in this case, this is not. So in this case, it is not 15, it is 12. So beta globulin is associated with 11p12. So what is the disease implicated? So in alpha globulin, we saw alpha thalassemia. So here naturally it is beta thalassemia, and other thing will be the sickle cell anemia as well. Next, moving on to the adenosine deaminase. So adenosine deaminase is associated with the 20q13q-TER, and the disease associated with the phenylalanine hydroxylase is the phenylketonuria. So let's recap this. So we discussed about beta globulin, which has a 11pq12 in chromosome, and it is associated with the beta thalassemia as well as the sickle cell anemia. Next we discuss the adenine deaminase, which is associated with the 20q13q-TER, and the disease implicated is the phenylketonuria. Then we move on to the hypoxanthine guanine. Hypoxanthine guanine. So hypoxanthine guanine phosphoribosyl transferase. Phosphoribosyl transferase. So hypoxanthine guanine phosphoribosyl transferase. So this, the chromosome involved will be the XQ26Q27, and the disease implicated will be the Lish-Nyhan syndrome. So let's recap what we have done. So we discussed about the beta globulin and the adenodeaminase. So next we also saw the phenylalanine hydroxylase. So under the phenylalanine hydroxylase, we discussed the chromosome involved was a 12q24. So 12q24 was associated with the phenylalanine hydroxylase. Next, the disease associated with the phenylalanine hydroxylase is nothing but the phenylketonuria. Then comes the hypoxanthine phosphoribosyl transferase, the HGPRT. The HGPRT, as we saw, it is associated with the XQ26Q27. The disease implicated is the LN syndrome, that is the Lish-Nyhan syndrome. Lastly, we look at the DNA segment. So DNA segment G8. So DNA segment G8 is the nothing but the chromosome 4p, and this will be the Huntington's chorea. So we saw about the DNA segment G8. So chromosome is 4p, and it is the Huntington's chorea.